Hi everyone, I am Dr. Sandeep Dachuri, Consultant ENT Head and Neck Surgeon at KIMS Sunshine Hospitals, Begumpet, Hyderabad. Today we are going to discuss about sinusitis, which is a very common problem. What are sinuses? Sinuses are air-filled cavities which are present around our nose. These are frontal sinuses which are present above the eye. These are maxillary sinuses which are present below the eye, and in between the eyes there are ethmoid and sphenoid sinuses. These are air filled cavities, as I have told. If there is any infection or inflammation of the lining of these air filled cavities, it's called as sinusitis. There are major and minor criteria to diagnose sinusitis. Coming to the major criteria, if the patient is having nose block, a nasal discharge, decreased sense of smell, facial pressure, facial pain, if it is acute rhinosinusitis, we consider them as major criteria. Coming to the minor criteria, there could be halitosis, that is foul smell coming from out of mouth. If the maxillary sinus is involved, they can have teeth pain, having lot of cough, fever, ear pain. These come under minor criteria. What are the causes of sinusitis? There could be many causes for sinusitis, just like genetic causes like cystic fibrosis or some immunodeficiency, or there could be exposure to cigarette smoke. There could be passive smokers. It can lead to sinusitis. Those who are having allergy in the nose can easily get sinusitis. If somebody is immunocompromised with uncontrolled diabetes, they are more prone for sinusitis. Rarely, if there is any deviation in the nasal septum or if there are huge turbinates, they also can lead to sinusitis. If the sinusitis is less than 4 weeks, we categorize it as acute sinusitis, and if the sinusitis is more than 12 weeks, we categorize it as chronic sinusitis. Some people, they might ask, are there any complications of sinusitis? Can I not treat it and be like this? Yes, there are complications of sinusitis, especially in children in whom the facial bones are still forming. So when the child gets sinusitis, as the eye and the brain are very nearby, the infection can spread through the thin bones or any crevices between the bones, and the eye can get inflamed. There will be swelling of the eye, loss of vision, redness in the eye, proptosis, which is eye popping out of the orbit. So these kind of complications can happen with the eye. Sometimes the infection can spread into the brain and it can cause abscess there, it can cause meningitis, it can cause seizures or fits. These kind of complications can happen. They are more common among children, and rarely sometimes the osteomyelitis of the bone, suppose this is the bone of the frontal sinus, there can be infection of the bone itself, and they are called Pott's puffy tumors, and if you press on it, it will be soft, the bone will be soft. These kind of complications can happen, but they are very rare. Coming to the treatment of sinusitis, there is medical treatment, there is surgical treatment. Usually in acute rhinosinusitis, we treat them medically. In chronic rhinosinusitis, if there is indication, we try maximal medical therapy, and if it is not working out, we prefer operating on these patients. What are the other treatments that are available for sinusitis? Saline nasal sprays and saline douchings are FDA approved, proven to be beneficial in all cases of sinusitis. So this saline nasal douching or sprays, where you pass saline through one nostril and it comes out through other nostril, it's called douching, or plain sprays, will definitely help in clearance of the secretions and recovery of the mucociliary function, which is required for recovery of the sinuses. Coming to steroid sprays, the moment you tell the patient that you have to use steroid sprays, the patients get scared that, oh, I have to take steroids for sinusitis. Nothing to worry. Steroid sprays are in micrograms, they are not heavy dosage, they don't have any side effects, they can be given even in a child who is 2 years old. So we usually routinely give steroid nasal sprays to reduce the inflammation in the sinuses. Coming to the surgical treatment of sinusitis, we call it as functional endoscopic sinus surgery. Here we don't make any cuts on the face, it will be done through the nose, through the normal nostrils with the help of an endoscope and some instruments. If it is only single sinus, we can do something called as balloon sinuplasty, where a balloon will be sent into the door of the sinus and the balloon is swollen up. so that the door is open and sinus can be cleared. But if there are multiple sinuses involved, we usually do functional endoscopic sinus surgery, where we open up the sinuses, all the doors are open up, so that we help all the sinuses to be cleaned at a later time and for the normal motility of the cilia. Thank you.